Chris.
Hi.
Hi. Okay, so let's get started. So welcome everybody to this event. I'm very excited about it, and thanks for joining on this Thursday evening. My name is Nicholas Layton. I'm a second-year medical student and the president of the AMA at GW, albeit. But before we get started, just a couple housekeeping things. We have some great questions that you guys submitted beforehand. But if you come up with any questions that you think of during the event, feel free to chat the moderator and we will do our best to get to them. And I would just like to invite the Dean of the GW School of Medicine and Health Sciences, Dr. Barbara Bass, to say a few words. Dean Bass, thank you so much for joining us this evening. Oh, hold on one second. I think you're muted. There you go.
Thank you so much, Nicholas. It's wonderful to be here. And Dr. Harris, thank you so much for joining us. It's really wonderful to welcome you virtually to GW School of Medicine and Health Sciences. Tonight will be very engaging because I know our students have an incredible sense of community, purpose, service. I think you'll have a wonderful evening and we're thrilled to death to have you with us. I think one of the things that, obviously we have an AMA chapter here, but I think one of the things that medical students don't always know, which I'm sure you'll speak about, is how important it is to be a servant to your profession. You know, we focus so much on being a servant to our patients, which is obviously the core of what we do and why we do exist as a profession. But a profession requires nurturing. A profession requires participation. One of our core values of professionalism is, of course, that we advance our profession. We serve our colleagues as well. We take care of each other, and both in terms of education, in terms of professional development, in terms of just comfort and collegiality. So, and I know the AMA has had so many wonderful programs that have served across the spectrum of a profession, a professional in medicine's life and this career. And I'm a surgeon by training, but still a member of the AMA, of course. And but had the pleasure just before you became president of serving as the 98th president of the American College of Surgeons. And so I too have committed a large portion of my life and professional life to serving our profession, building educational programs and collegiality. So I'm so glad that our students are focusing on this particular aspect. And I'm so glad that you can be here with us, particularly during this most incredible year. I too began this new role here at GW just prior to COVID. So it's been an amazing year for you, and I'm sure you have had an extraordinary year. So thank you for all you've done during this time, and I really look forward to your comments. And again, thank you to our students who have invited you here. Enjoy your evening.
Well, thank you very much. And thank you for the opportunity. And maybe one day we'll discuss, a lot of my colleagues call me a surgeon psychiatrist. So we can discuss maybe at another time what that means. But I'm so honored to be with the students because the students inspire me always. And so it's just a pleasure to be here with you.
Very good.
Thank you. And thank you so much, Dean Bass, for saying those words. I think that definitely resonates. I think it's very relevant because I actually met Dr. Harris back in 2017 when I was actually working as an intern for the AMA Foundation, and she was a board member for the foundation. And even back then, her reputation preceded her as a fierce patient advocate and a leader in medicine. And just a little bit about her before we get started. 1 year later after I left, she was elected AMA president, and notably the first African-American woman to hold that position. And her experiences as chair of the AMA Opioid Task Force, as a leader of the American Psychiatric Association, and as a professor in psychiatry and behavioral sciences at Emory and Morehouse Schools of Medicine equipped her to be one of the most qualified presidents of the AMA on day one. And not only did she meet those expectations, but she surpassed them. Because as we all know, COVID hit, just 7 months into her presidency. And when the COVID pandemic hit, she used her platform as president to address the PPE shortages and urge communities on how to reopen safely. And not only that, but I think what's so important and very relevant to the GW community and what we stand for is that she recentered the conversations on COVID-19 on how this exposes pre-existing health inequities that disproportionately affect Black, Indigenous, and communities of color. And then a few months later, the nation confronted another systemic public health crisis of police brutality. And after the tragic deaths of Breonna Taylor, George Floyd, and too many others Dr. Harris and the AMA were quick to urge leaders of local health organizations and leaders of American health organizations to approach excessive police force in the same way that they were approaching COVID-19, as an issue of public health that drives unnecessary, costly injury, premature morbidity, and death. And for these reasons, I was really excited to reach out to her, to the AMA, to invite her to GW, and I'm so excited to introduce the past president of the AMA, Dr. Patrice Harris. Thank you so much for being here.
Well, thank you for having me, and I really look forward to the dialogue and the question and answer period. But I do want to say a little bit more about how I first became involved in organized medicine in our professional societies. And it started with a day at the Capitol at the Georgia General Assembly during my last year of training. And I went down to Psychiatrist Day at the Capitol, and I'm standing at our rope line. It's where we stand to, all citizens can stand to meet their particular state senator or state house member. And I heard a fellow citizen who I'm sure meant well, but who made a candidly ridiculous claim about some herb or something. I'm not sure I totally remember curing cancer or as a treatment for a medical illness that I just knew to be patently false and not evidence-based. And it hit me then, that was my light bulb moment, that physicians, of course, medical students and residents, we work hard every day doing what we're supposed to do, but legislators are making decisions about our ability to take care of our patients in the best manner possible. And so it was just necessary. And I have said for many years that we should consider advocacy just as much a part of our professional obligations as we do getting our continuing medical education credits. And so I began first working locally in Georgia, then nationally at the American Psychiatric Association, and then finally at the American Medical Association. So I am unapologetic about my advocacy for medical students, residents, and physicians to be engaged and involved. You can find your own space and place, but it is just necessary for us to be involved and engaged. And I actually feel like I'm preaching to the choir because my younger colleagues are already involved and engaged. When people say, why should physicians care about the social determinants of health or the structural determinants of health, you all have the best answers. And it's almost second nature to you. You don't even appreciate or understand the question because we have the privilege of seeing patients and seeing all that impacts our patients day in and day out. And so if not us, then who? Mm-hmm. We absolutely have that opportunity. We have the best information. We can ground our discussions in science and the evidence. And so again, I'm just glad to that I have had the privilege, I believe, of being the president of the AMA at this particular moment in time. And I hope to continue my work beyond AMA. And I will always be an advocate for our patients and for our profession.
Thank you. Thank you so much for saying that. Honestly, that's something that I'm very excited to hear your opinions on, because at GW, we are obviously in the heart of the nation's capital. And especially in 2020, I think there has been so many conversations about what line are physicians allowed to advocate for patients. And I think what really resonated with me with your term as president is that you really urged the AMA to weigh in on very substantial things that are happening right now. For example, I know that you wrote an article in May with Dr. Ehrenfeld addressing police brutality. And in the article, you stated, and I quote, "Racism is detrimental to health in all its forms. In any season, police violence is an injustice, but its harm is elevated amidst the remarkable stress people are facing amidst the COVID-19 pandemic." Can you speak a little bit to how you envision physicians and medical students, like what role do they have in combating systemic racism?
Well, there's a space and a place for roles in many systems, but let me just say it starts with each of us individually. Mm-hmm. And all of us have biases. All of us have prejudices. We bring to medicine, right? We bring to medical school all of who we are. So there's no way around that. The key issue and exercise and activity is to be willing to examine ourselves, our own biases, our own prejudices. Ask the questions, perhaps I am bringing something into this exam room that might influence my ability to give the best care for this patient. Be willing to learn and engage. You know, we don't have enough data on the best tests for examining our own implicit biases. I think the test at Harvard is a good one, though. It's one that Chief Health Equity Officer at the AMA recommends. So I think it starts with us individually, right? And then it starts with schools, right? And institutions that we engage in, examining, all organizations examining themselves, asking or looking around around the decision-making table to make sure that there's a diversity of thought and opinion and race and ethnicity and gender identity around those decision-making tables. I think it's incumbent for everyone to look at policies. Are there any policies that unintentionally or intentionally actually exacerbate health disparities? So I think it starts with us individually, but then all of the institutions that we belong to. Certainly the medical schools should be doing this. The graduate medical education training program should be doing this. Universities should be doing this. And I know there's some work at GW looking, again, not just in the recent past, but really looking throughout all of the history of this country. And having thoughtful, evidence-based, and sometimes uncomfortable conversations. Certainly structural racism is an important piece of that conversation. It is woven into the DNA of systems and policies, our educational system in this country, our health system in this country. And so we really have to be willing to first name it. And that's what Jesse and I did in that article. You know, you have to name it. And we hoped that we elevated it so that people could have a topic of conversation. It was a conversation starter. And then going forward, you know, what do we do about this issue that is being named, unfortunately, in the tragic deaths of the three people you just named? Well, you named two, and I like to name Ahmaud Arbery because he lived here in Georgia and he was just out for a jog. And there wasn't even police involvement. So it's a little bit different. But so we have to elevate these names and then be willing to have these conversations. And so that's what we endeavored to do in that article, and to demonstrate that we in the medical profession have a responsibility to name these issues as well, because they do impact the health of our community.
Thank you. Yeah, and I urge everybody to read that article that Dr. Harris and Dr. Ehrenfeld wrote for the American Medical Association. It's called "Police Brutality Must Stop." It's a fantastic article outlining what we need to do in this moment as physicians and as institutions in order to combat this problem. And something that you spoke to just in your answer right there that I kind of want to unpack a little bit is the role of medical schools in shaping this conversation. I think I'm very lucky to be at GW because this conversation is something that we're already having and we have been having just even that surpasses even structural determinants of health and structural racism. I think GW really prepares us to be physician advocates, and I'm very grateful to this institution for preparing us in that way. But outside of GW, I do think that there is a conversation about professionalism in medicine that is specifically leveraged against medical students, residents, physicians who publicly advocate or who challenge these ideas of entrenched racism within the medical community. And especially as medical students, we are new to the responsibility of wearing a white coat and advocating for our patients, speaking on these issues, especially in 2020, where this is the time where these issues are highlighted. So how would you suggest we go into our practices? How do you think we should understand that idea of professionalism and also advocacy outside of our medical school in our professional lives?
So first, let me say this, and I want you all as medical students to make sure that you are practicing self-care. Because there is a lot of work to do in this country. There's a lot of work to do in healthcare, and it can be overwhelming and it can be exhausting. There are a lot of problems to solve, and you all are just beginning and trying to get through medical school. So I do want you not to feel like the weight of this, even though I say I'm inspired by medical students and they are leading the way. You should not feel the weight of this, and it's up to my generation, mid-career, and all of us to carry this load so that we can hand off our profession to you. But you have, of course, great voices, but I do want you to pace yourself and make sure you're practicing self-care. The work will go on. There will be others like me who will do the work so that you don't have so much to bear when you begin practice. I have to say, sometimes the first thing I do sometimes when I hear a narrative that is ridiculous, I do try to meet people where they are. And maybe as a psychiatrist, I try to understand. But then when it doesn't make sense, I then don't give it any energy. So I believe you're asking, so I believe people are saying, well, it's not, professionalism and we shouldn't even worry about these other issues, and it should just be about the patient in front of us and just be about the illness and all of that. And I will just say, I just don't entertain that. And so if you believe that appreciating and understanding patients in their full context, that's what I believe is the best way to give care, then go with that and don't allow anyone to talk you out of that narrative, right? That narrative of professionalism and that narrative of your work. Because you know what, the data is clear. And let me just, just share that, we talk about whether or not our patients are taking their medications. And a word that was used when I was in training was non-compliant. Thank goodness we moved a little and we got to non-adherent, because compliance was denoted such a power dynamic, right? And so we got to non-adherence. But if all we write in the note, and even if we don't use the term non-adherent, if all we write in the note is the patient is not taking their medication, and then we move on to the next, we are missing the full context of our patient's narrative, and we won't be able to give the best care. Now, I will say this broader problem is not physicians alone to solve, but we have a front row seat to a lot of these issues, and that was what I was alluding to earlier. But if I write my patient is not taking her meds because she cannot afford her meds, she is paying the rent for herself and ex-family members, she lost her job, the insurance company won't pay for the medication. So we have to dig a little deeper. We have to get beneath the headlines. And I believe searching for that full narrative, all of those social determinants of health, again, not ours alone to solve. The physician cannot solve the fact that there are no grocery stores in a neighborhood, right? Not in that moment and not in that patient encounter. However, physicians in organizations, again, and I am biased here. I am unabashedly biased to the importance of organized medicine, but physicians working in groups, and it doesn't have to be organized medicine, but if I'm biased, working in groups can make a difference. Medical students working on PPE made a difference, right? And so I think that you don't have to accept, even if it's someone that you respect, you don't have to accept someone else's narrative about what's professionalism, right?
Yeah, thank you. That's very, helpful to just understand. And I think what you said, I'm really interested in your experience as a psychiatrist and being able to look through that lens on everything that is going on, and I'm sure it has really impacted how you are able to look at these issues, especially as president of the AMA. And just going back to that article, because I thought it was just awesome. You said, quote, corporeal and psychological violence at the hands of police is a derogatory device of enforcement, which is a philosophy our AMA cannot abide. It exacerbates psychological harms.
Oh, I think I may have lost you.
Oh, sorry.
Okay.
That was my bad. But can you just, and it has a clear impact on bystanders is the last part of that quote. But can you just speak a little bit to the psychological toll of police brutality, especially in the context of COVID-19, and how we can better understand it as providers?
So I think we should think about this in the context of trauma and witnessing trauma. And I think the data has been clear that trauma impacts both our psychological health as well. And I'm going to use the term physical health. I really hate even separating the two, but it's in the vernacular. So, trauma impacts our psychological health and later development of symptoms such as anxiety or depression, or even the clinical disorders of an anxiety disorder or a mood disorder. Trauma, we also know that trauma can impact the development of hypertension and diabetes. We also know that you don't have to have experienced the trauma firsthand for it to have an impact on you. Even witnessing trauma, either close up or from a distance, can also have an impact. And, I remember talking to some of my patients after 9/11, and these are children. I'm a child adolescent psychiatrist, and many of them watching the news with their parents, and again, or maybe even their parents are watching the news and they were in another room, but many children saw the replay as continued episodes of planes flying into buildings. And so there was some vicarious trauma here. And so again, and police brutality is a community trauma. There are certain moms and dads in this country who have to have conversations with their children about what to do if they are pulled over by police. And there are certain parents and families who don't have to have that conversation and who walk out of their front door every day and don't have a fear of being stopped. Of course, unless you're doing something wrong, but, just in day-to-day interaction, don't have a fear or worry about that. And it's that fear or worry that also adds to the anxiety and the trauma. And many of my mom colleagues who said they could not watch, and it took me a moment to watch the tape of George Floyd, because these were moms. I am not a mom, but these were moms, and they said they could not watch it because it just brought up so much anxiety and worry about their own children. So again, all of those are just opportunity after opportunity for a traumatic experience, which we know impacts our health. And so we have to appreciate all of this in the context of trauma, whether or not you have directly experienced it, or if you are experiencing it from afar, or if your day-to-day existence has to always be edited and monitored I even think about this, not, of course, as in police violence, but if every day you're wondering and monitoring and editing what you say and what you do. I share this experience that I, throughout the course of my career, monitored what I said. I didn't want to be seen as the angry Black woman, and so that is also exhausting. I wouldn't say it was traumatizing, but it's exhausting, and it just adds to the stress of everyday living that some people in our community have to deal with and others do not.
Yeah, thank you for sharing that. That's very insightful. I want to move a little bit to what it was like for you to be the president of the American Medical Association during the beginning of COVID. As president of the AMA, you represented the frontline physicians, residents, medical students who were risking their lives and also the ones of their loved ones. What kind of thoughts were you having towards the beginning of this pandemic, and how did it evolve as you started to recognize what this virus would demand of us personally and of our society?
Well, I think like most of us early on, we began to get worried. I think we in the medical community sort of could, based on our training, could see what was potentially in store for us individually, our families, our country, our world. I will have to say during those first couple of weeks, I did not imagine, right, that we would be where we are today. But again, early on, of course, along with the wonderful AMA staff, knew that we needed to make sure that we were the trusted source of information and that we were talking about the critical need to allow science and the evidence and data and facts drive decisions. Unfortunately, in the first couple of months, we saw that this pandemic was being fought out in the political realm as opposed to the public health world where it should be, and allowing this research. And that's why we came out early, and I did the 30-minute broadcasts about the importance of science and data and the evidence. And I will tell you, I believe that that is the most important piece of work that we did at the AMA. I think at the very beginning, we grounded those words. I cannot tell you, even today, and people are saying it less now, but for the next month, you heard science and evidence and data so much. So I think I love our AMA, and I believe we had an impact by grounding where we should be and how we should be thinking about this. Early on, we called for HHS and CDC to collect the data regarding race and ethnicity, because early on, even though we did not have complete data, and we still don't, we saw that in certain communities, this virus was disproportionately impacting Black and Brown and Indigenous communities. I think the other issue we raised was the importance of the media, both social media as well as traditional media, in making sure that they were not adding to the misinformation and the disinformation out there. That's certainly easier for traditional media, but then we educated the community that, you should make sure you get information from a physician who went to medical school, not on Facebook. Dr. Facebook was not where you should get your facts and your information. And I have to say, on a personal note, and I've shared this story before, I spent the first 2 weeks of this pandemic, not in my role as AMA president, but in my role as friend and family member, because so many of my friends and family called me up and said, hey, we don't have to worry about this, right? Because Black people are not at risk of becoming infected with COVID. And I had to dispel that myth to family and friends before we had the broader platform. So I think that was critical, and I think we grounded that early on, and I think we put our stake in the ground, if you will, And that has served us well. And I remember as we were talking, as I was talking to the communications team, what we said was, we knew that science evolved, and we knew that, you know, in June, we would know more than we knew in March. And in August, we would know more than we did in June. And so we really wanted to be very careful and scrupulous about the words we use, because we wanted our words, our articles, our COVID-19 resource page. Certainly, those were living documents, but we wanted history. Let me just say this. I'm a big Hamilton fan, and, you know, and I may not get this exactly right, but history has his eyes on us. And I remember thinking that early on personally. History has its eyes on the AMA. And I wanted to make sure that I personally, in my role as personally and in my role as representing AMA, that history would look kindly and favorably upon the work that we did, and not for good PR, but because we were physicians standing up for our patients and science and the evidence.
Yeah. And I can't imagine how difficult it is to be that voice, you know, that is representing physicians, and on one hand communicating to physicians and medical students and residents, you know, the impact that COVID is going to have on them, taking care of them, and also having to be the outward facing voice to the public, you know, to cut through sometimes the media hoops that they jump through, you know, to deliver an effective message about the stakes of this and what we need to do to best prepare ourselves and to best protect ourselves. And on that note, what do you think is missing from the national conversation on COVID right now?
Well, I think we are seeing most folks, not all, understand the importance of science and data. But what I think is missing, actually, and it's been missing from the very beginning, is a coordinated national strategy. That's been missing from the beginning, and I think so many missed opportunities, and we are where we are today. Now, the one regret that I have, and not me personally, and not even the AMA, but I do think, and my psychiatry training is coming in, that we talked about the urgent need to shelter in place from the very beginning and wear a mask. And what we didn't do, and we didn't have to be real precise in this, we didn't say, this is phase 1 and here's phase 2. Because I think folks get so focused on phase 1 and, oh my goodness, I can't do phase 1 forever. So I'm going to throw up my hands and I'm not going to do anything. And of course, also hearing mixed messages on what to do didn't help. But if I could go back, and again, not just as at AMA, I think all of the medical and scientific community, I wish we had said, you know what, for phase 1, not predicting how long phase 1 would last, but I know that people can handle bad news. They just want to know the next step. And they just want to know the next step is going to be different and a little less scary. And we could have, but you know, in hindsight is 2020, and we were really appropriately focused on the moment and what we needed to do. But again, if I had to do it all over again, and again, knowing now, knowing what I know now, I would have sort of prepared the public more for the phases of this, so that they could see the light at the end of the tunnel. Yeah, we were in a dark part of the tunnel, but there is a light at the end of the tunnel, which will require work. So,
yeah, that's great. Thank you. And just on that note, of course, your term, you know, when you took the office, looked very different than when you left office. But even back then, though, you know, where did you want to take medicine? You know, you're representing the largest association of physicians, of medical students and residents. And of course, there's a lot of power behind that, you know, speaking on a national stage. And when you assumed, you know, the role of president, what impact did you want to have your presidency to have on the AMA and also just the medical field right now?
Well, I had three goals that I said I wanted to amplify and elevate during my term as president. Of course, the AMA is a very uh, disciplined organization, and we have our strategic arcs, and any good organization should have a focus. You know, I actually talk about our bad habit in this country of careening from one crisis to the other and not having a clear sense of purpose in where you want to go. And so certainly, you know, we have those three strategic arcs at AMA, and improving health outcomes, focusing on chronic disease, accelerating change in medical education, and what we call eliminating, decreasing the burden on physicians. Again, those burdens that interfere with our ability to give the best patient care. But I also wanted to use my time to elevate the importance of integrating mental health care into overall health care, elevating the importance of a diverse physician workforce, but not a diverse physician workforce as the endpoint. You know, some folks think of a diversity checkbox. Really, a diverse physician workforce, a diverse organization is a better organization because their end goal is equity. Mm-hmm. And more equitable healthcare. So a diverse physician workforce in the service of equity. And the last is an elevation and a focus on trauma. Yeah. Now, I have to tell you that although, again, would not have wished COVID on our world, COVID really has amplified those very things. People are now talking about the importance of mental health, and unfortunately, how it has been underfunded for decades. People are now talking about equity and diversity. And as you asked me at the very beginning of our talk together, people are talking about trauma. Yeah. And so those are my goals going in, to amplify that. COVID, of course, amplified those, and that will be my work going forward. You know, in your previous question, we try to have some levity in this, but, you know, I belong to a sorority, and at my inauguration, you know, I brought all of who I am to the inauguration. And my sorority is the first sorority founded by Black women at Howard University, Alpha Kappa Alpha Sorority Incorporated. But I tell you, at the end of my presidency, one of my sorority sisters' mothers texted her and said, when does Patrice say we can go out? So, you know, I thought, okay, my job is complete, because people, and this is Patrice representing AMA, but people were saying, I'm listening to the AMA. And she said, I'm not going out until Patrice and the AMA says it's okay to go out. So, you know, I think that's the power of the organization, but also the ability to really impact health outcomes.
Yes. Well, I mean, it's a very exciting time for your sorority right now that Kamala Harris, you know, who I believe is also a member of the Alpha Kappa Alpha Society. And that's great to hear. And I think on that note, you're talking about, you know, physician burnout, which of course is amplified, especially during this time. You know, every frontline worker is experiencing this, of the pressure of having to put themselves in this position that harms themselves and their family. So how do you think that physicians should advocate for their own well-being during this time, and, you know, in residency and beyond?
Well, you know, I always, when I'm speaking in front of young audiences, I always say, be true to your authentic self, right? Be authentic, but you also have to be strategic. Mm-hmm. And here's just a fact of life. At different times, I talked about privilege earlier today. At different times in our careers, in our lives, we have different privileges, right? And so we cannot always, and this is a life lesson that we hopefully learn before we're 5 or 6, we can't always say the first thing that comes to our mind, even though we really would want to. But we can't always say it. We have to be strategic. So clearly there are times when I feel like, having had the presidency and other rooms that I'm in, I do have the privilege of saying things now that I didn't have 10 years ago. So I would say we always have to be true to our authentic selves, and we always have to advocate for us and our safety, but we can do that in different ways. And people should always do that in a way that doesn't impact their own future success. I have to say that. Now sometimes people make decisions that, you know what, I'm going to say this, and if it ruins my career, I'm being a little bit hyperbolic here, that's okay. And all of us may make those decisions. Do we say, listen, this is important enough for me to act on it, to protest about it, to say it in this audience and this time. But again, if you make that decision and it's a strategic decision, I will support that. But my point is, there are times when you say things individual, and there are times when you get your tribe to say things, right? Or there are times when you get your organization to say things for you. So I think it does depend on what the issue is. We can always advocate for what we need. We just need to be strategic about the advocacy. I mentioned that I was on that panel yesterday with Reverend Dr. Bernice King, and she was asked, and just for clarity, because folks might not always know the name, she is the daughter of Martin Luther King Jr. And she was asked about the protests, the various protests, and she talked about a lesson that she learned from her father and that they teach at the Nonviolent Center here in Atlanta, and the importance of protests are wonderful tools for change. But she said she recommends protest, and I'm paraphrasing, in the context of an overall strategy and purpose. Mm-hmm. And so I would say advocacy for anything we believe strongly in is critical. We put that in an overall context and purpose and have a strategy. Because, when I was a full-time lobbyist here in the Georgia General Assembly, and I learned a lot, and one of my mentors, not a physician who was a lobbyist, once asked me this very important question, because I was infuriated because there was some bill that needed to pass because it was based on the science and the data. And my argument was it was based on the science and the data. And she said, Patrice, do you want to win the day or do you want to be right? Well, she says, do you want to be right or do you want to win? And so I think her lesson was pretty much be strategic. You can argue, you can be self-righteous, you can say, well, this is right, and I'm a doctor and I have the data and the science to prove it. Or you can take a step back and figure out the strategy to get what you want done. And you might not be able to, prove yourself right. So I think it's important to have a strategy, advocate for yourself, but use others when you don't always have the privilege of advocating for yourself.
Thank you. And we actually have a lot of questions coming in. So there is a question from Dr. Raymond, who is the past chair of the AMA. And he is asking you to comment on the AMA as a democracy. Can you just speak a little bit to how the AMA functions, particularly the House of Delegates with all the specialties and physicians that are represented, and how much diversity exists within the AMA?
I can, and I believe that House of Delegates is the jewel, the crown jewel of the AMA. And so for folks who don't know all the inside baseball, and I know it can be a complicated organization, but I think of it as the Congress of Medicine. So we send, there are 2 senators from every state, and then there's various number of representatives based on the population of a state, send those to DC. Well, that's what happens in the AMA. Based on your number of AMA members from a particular state or specialty, you have that many representatives in what I call the Congress of Medicine. And that Congress of Medicine then decides policy. And once policy is made, our advocacy team in DC and then across the country, of course, in concert with state societies, advocate for specific policy. And I believe this democracy of the AMA, and we are a very democratic organization, is why our policy is so respected in DC. Mm-hmm. Because they know that it's not, but 21 very smart, bright physicians and medical students and 1 public member who are the board of trustees. But I think it's so much better to say, this policy was debated and voted upon by physicians who represent every state and every specialty in this country. That's so much more powerful than saying a board of trustees of 21 members voted and this is the policy. So I think our House of Delegates, because it's diversity of region, geography, all specialty, brings power to our policy. Now, every 2 years or so, the Council on Long Range Planning and Development looks at the demographics of our House. I don't have that data memorized. That data would be available for the public. But I can tell you in the 25 or so years that I belong to the AMA, it's certainly become a more diverse House of Delegates. Absolutely no question. Are we where we need to be? Probably not. Actually, I was a little late here because I was just on a health equity panel internal to AMA right before this, and we were just talking about the progress that has been made. But all of this work is a journey, not a destination. And so we need to continue to work to make sure that we have diverse representation in our House of Delegates.
Absolutely.
But I will tell you, though, that there are 21 members on the board. And of course, this Bill McDade rotated off, and Kevin Williams was our public member. But when I first got elected to the board in 2011, 7 of the 21 members were women. Mm-hmm. Just this past year before our new board, 5 were African American. We had Jesse Ehrenfeld, who was our first gay chair of the board of the AMA. So we are certainly becoming a more and more diverse organization, not just in state and specialty, but also in gender, race, and ethnicity.
That's great. That's awesome to hear. And many of the students on this call are first-year medical students. So, only a few weeks into their medical education, what kind of advice do you have for them as they just begin their medical career?
I think self-care is the best advice, because you, as we all are entering uncharted territory. There is no playbook for this. There is no playbook for a first-year medical student entering at the time of a worldwide pandemic. And so I know that, the dean, started at a great time. But I know that the medical schools are really working hard to make sure that medical students are protected. We actually at the AMA, some of our early resource documents were around protecting our medical students. We know that medical students, or those at the end of their career, were being called into service earlier than they had anticipated. We knew that there were issues around moving into a new city, especially where the pandemic was spreading, greater than 5%, a lot of community spread. We know that, and these are first year medical students, we know that the residents are having challenges in entering residency. So I would just say, take care of yourself first and foremost. Make sure you let others know what needs you have. Don't labor in silence. And I mean, if something is not going well, let someone know, because again, you are entering medical school at a time where there is no playbook, and none of us really know how to do it. So you will be able to write the story and tell the story of how you began your career. Lessons learned. Not everything will be perfect. Lessons learned. Hopefully we won't get to where we are today, but you can teach us lessons in how to be prepared, because we will encounter another public health crisis. There's no question. You just don't get out of having public health crises, but you all can help us with the narrative and write this story and what we need to do to be better prepared.
Thank you. Yeah, and another question came in, just talking about how healthcare was the most defining issue, I would say, of the 2018 midterms. Can you just speak to a little bit about the AMA's impact on federal, state health policy?
Yeah, again, I think our policy is so widely respected on Capitol Hill. And I can just tell you from personal experience of being in the room with senators and congressmen and women, I can tell you firsthand how much they respect our work and our policy. I have been in rooms with the FDA commissioner, the Surgeon General at various times. I've been to the White House. I went to the White House and talked about policies around vaping and flavored e-cigarettes. And so I can tell you that when health policy is being debated, people want to know. Our policymakers, both in the legislative branch and the executive branch, want to know what the AMA thinks. And I will tell you also, and this is a piece that we don't talk enough about, the AMA is very involved at the judicial level. I mean, we have put forth, and we can get you this information, so many amicus briefs. I mean, when North Dakota, I believe it was North Dakota and another state passed these ridiculous laws, these gag laws about what physicians could say to women about their reproductive health, the AMA was engaged and involved. We are engaged and involved in the lawsuit to dismantle the Affordable Care Act. So the AMA is very engaged at all levels of policymaking. And I can tell you this, and I say this with pride, there have been many, and not just physicians, but many who say that, as many of you may know, or you may not know, that the AMA supported the Affordable Care Act. And I have heard from so many people who were intimately involved with the Affordable Care Act that if not for the AMA, the Affordable Care Act likely would not have passed. Now, let's just be clear. The Affordable Care Act was not a perfect piece of legislation. Many things that we need to change. You all know that we believe, though, that we should build upon the success of the Affordable Care Act. So many more people were able to access health care. I know as a psychiatrist, I know so many more people were able to access care for substance use disorder. Medicaid expansion has been so important. So again, it speaks to the power of the policy and the work of the AMA.
Absolutely. And I know that the AMA has been very supportive, of the LGBTQ community recently, especially this summer with the, suggestions that the current administration had about the 1557 waiver that would specifically target, non-gender conforming or transgender patients. So I really appreciate that advocacy. It really helped drive the conversation on that front. So unfortunately, we only have time for one more question, but I do want to ask, what final words do you have for everybody of why they should either join the AMA or support the AMA in any way that they can?
I do, because I believe in candor, so I do want to say this, and I don't want to pretend. Just like I said, the Affordable Care Act was not a perfect piece of legislation. The AMA has not been without its own blemishes. Years ago, the AMA did not allow Black doctors to join the AMA. In 2008, though, the late President Ron Davis apologized on behalf of the AMA to Black physicians in this country for not allowing them to join. So I say that to say the AMA, just like our country, just like all of us are individually, just like GW, we are on a journey, right? Not a destination, to evolve and get better, to admit where we've made mistakes in the past, build on the power that we have in this organization and move forward. Because at the end of the day, it's about improving the health of our patients on an individual level, the N of one that's in our exam room, but really the public health of our country. And so I encourage everyone to join the AMA, to get involved and engage so that you can be a part of that change. Some people ask me, I know we don't have a lot of time, as a Black woman, how do you feel about being involved in the AMA? It's passed. It didn't allow African-American physicians. And I said, for me, as a personal choice, I've always believed in change from within. Mm-hmm. Now, sometimes you have to fight for change from without. But if you have an opportunity, you can sit at the table and change from within and make sure policies are inclusive and represent the diversity of who we are in the physician community. So I encourage everyone to join so that you can be a part of that change, because you do impact policy. Again, very democratic process. So every vote counts. And so you get to impact policy so that we can all improve the health of our patients. And that's why we chose this profession in the first place.
I don't think that there is a better time to end on that note, because that is a great way to talk about it. Thank you so much for your time, Dr. Harris. This has been a really awesome talk. I've really appreciated hearing you speak about COVID, police brutality, all of this. I really appreciate your time. Thank you so much.
Thank you. My pleasure.
All right. Thank you guys all for joining us. And
everyone, study hard and stay safe. Wear your masks.
All right. Have a good one. Thank you.
Bye.